Welcome, Dr. Sheila.
Yeah. Thank you, sir. Thank you, English team. Now we are going to the English session. Good evening and warm welcome, dear all. Today, IFPH is conducting its 2161st day of uninterrupted daily webinar series. Before starting, 1 minute silent prayer. Thank you. I am Dr. Sheila Prem, today's moderator. Today, we are presenting an insight in various respiratory maladies and homeopathic remedies. So our guest is Dr. HITARTH N. MEHTA MD Homeo. He is the principal, Rajkot Homeopathic Medical College, Parul University. So we are warmly welcoming you, sir, in this wonderful platform. And at the same time, we are welcoming all of our teachers, students, well-wishers of homeopathy and all to this platform. Once again, thank you so much and being with us. Please, sir, Dr. HITARTH, you can now start, sir, please.
Anis sir, good evening, sir.
Good evening, sir. Welcome, sir.
Just a minute, sir. I will share this screen. Anis sir, my screen is visible. Hello, sir.
Yes, everything fine, sir.
Good evening, one and all. Respected Dhanesh sir, IFPH team, and my all dear colleagues and respected senior fellow.
I think voice is little bit low, sir, please.
Hello, madam.
Yes, sir.
I am audible right now?
Yes, sir.
Yes,
sir.
Yes.
So the topic is for today discussion regarding an insight in various respiratory maladies and homeopathic remedies. So my topic has been divided into two compartments. The first is we will discuss the various kind of the respiratory disorders, and second, that is the efficacy of the homeopathic remedy for the respiratory disorders. So today is the World Lung Cancer Day, and I am fortunate enough to present this wonderful topic in front of the IFPH team. So we have started with what is homeopathy. Under the homeopathy, the homeopathic system of the medicine, whatever kind of the disease we are facing, we have to start with the homeopathic case taking. Homeopathy is nothing but it is the homeo, that is similar, and pathy means suffering. So whatever patient is suffering for any kind of the ailments, we have to consider as a holistic approach, that is the holistic health to cure the homeopathic or establishment of the homeopathic practice. The second important phenomena, that is individualization. So our medicine is working on the plane of the individualization. Every person differs from one to another. Every person is like a unique. So we have to treat the patient as an individual from one to another only. The third important factor, that is the history taking and symptomatology. History taking, that is the case taking. And once we started that case, that is it is the art of collecting the symptoms from the patient to constitute the totality of the symptoms. And we have to form the totality in terms of the respiratory, to treat the respiratory disorders. Next is the symptomatology, to study the different kind of the symptoms, whatever patient is presenting in front of the clinic or in front of the homeopathic consultant. Next point, that is various kind of the respiratory system or respiratory disorders. And last, that is the mechanism of the respiration. So the parts of the respiratory system, we will start with the effect of the nose and nasal cavity. The ciliated epithelium of the nose, which filters the air inside the mucosa, and the pharynx is an important part which separates the two compartments and helps in the swallowing itself. Larynx is the voice box and responsible for the phonation or speech itself. Trachea is the tube that is the extending towards the lower larynx, and it helps in the mechanism of the respiration itself. And the principal bronchi, which has been divided into two main compartments, that is right and left bronchus. And that is the anatomy of the lung. Lung is having the main, we are having the two right and left lung. Right lung is having three lobes, upper, middle, and lower lobe. And left lung is having superior lobe and inferior lobe. And the bronchopulmonary segment. The bronchopulmonary segment is the wedge of the lung tissue, and that is supplied by the main bronchus and two segmental bronchi of the pulmonary artery and the pulmonary vein. So anatomy, unless until we are not knowing the anatomy and physiology of the respiratory tract, we cannot able to treat the patient. And underlying pathology is very difficult for any homeopathic consultant to treat it. That is the already under the upper respiratory tract. It has been started with the nose and nasal cavity, paranasal sinuses, pharynx and larynx itself, and lower respiratory tract, that is the trachea, bronchi, and bronchial tree itself. The lower respiratory tract, that is the very important function, that is the lung, and the majority of the case, the right lung which involved more as compared to left one, but because the right lung which is directly communicated with the main bronchus, that is the principal bronchus. So the majority of the infection, which is very common in right lung itself, and the majority of the part, the lower basal lobe or basal area of the lung which gets involved. The function of the respiratory tract, the main function, that is the airway mechanism, airway, that is the airflow. When we breathe in, the pressure inside the pleural pressure, that is less, and atmospheric pressure, which is more. So during inspiration, our lung expansion takes place, intrathoracic pressure increases. Once the intrathoracic pressure increases during the inspiration, and during the expiration, the volume and during the lung pressure, that is increases, and the atmospheric pressure, that is decreases. So the mechanism of the ventilation, pulmonary ventilation itself, which is regulated in tissue level and lung level itself. So the muscles of the accessory muscles of the respiration, which is useful for the pulmonary ventilation as well. The second function, that is the diffusion of the gases. So when we diffusion oxygen and carbon dioxide. So whenever there is oxygen saturation which is decreases, person is having the hypoxemia or hypoxia. And whenever there is CO2, that is carbon dioxide, increases, that is known as the hypercapnia. And the more than 80 mm of Hg of the carbon dioxide, which is known as the hypercapnic encephalopathy. So any kind of the oxygen and carbon dioxide is to maintain in the diffusion level, that is in tissue level and lung level itself. The transport of the blood and fluids, that is the oxygen and carbon dioxide, that has been already discussed. The regulation of the respiration, the mechanism of the respiration, which is regulated by the nervous regulation and chemical regulation. The nervous regulation, that is the in terms of the hypnotic center, which is regulated by the brain itself, and the chemical regulation, that is the central and peripheral chemoreceptor, which is responsible for the regulation of the respiration itself. That is the normal breath sound, inspiration and expiration. The main respiratory disorders we have divided into such a briefing. The first is upper respiratory tract infection. Second is respiratory failure, acute respiratory distress syndrome, pneumonia, pulmonary tuberculosis, bronchial asthma, COVID-19, pleural effusion, bronchiectasis, pneumothorax, bronchogenic carcinoma, emphysema, and chronic bronchitis. We will start with the first disorders, that is upper respiratory tract infection. Any kind of the upper involvement, that is the upper respiratory tract, that is up to the primary, that is larynx, and treated primarily with the supportive symptomatic relay. So that it has been started with the upper, that is nose and nasal sinuses, pharynx and larynx itself. And any kind of the upper respiratory tract infection usually started with the common pathogens, which is responsible for the, that is acute rhinitis, that is because of rhinoviruses. Any, the most common, that is novel coronavirus, which is responsible for the COVID-19. And any kind of the influenza virus, that is paramyxovirus, it is a type of the RNA virus which brings on the upper respiratory tract infection. So sometimes patient is having the laryngitis, hoarseness of voice. It has been commonly observed person is having the so much use of the voice and overuse of voice, timbre voice. So our homeopathic remedy has been differentiated on the basis of the which kind of the provoking factor, that is the exciting cause, and it's try to maintain, or that is the maintaining cause, are the causes which are continuation of the patient ailments. So any exciting cause which remains persistent, it becomes your maintaining. So maintaining cause, to treat the maintaining cause, we have to try to find out the exciting cause and remove it. So in to treat the laryngitis, we have to give the modifying the lifestyle of the individual. And sinusitis. The sinusitis is a very common phenomena where the most of the ENT are having the paranasal sinuses X-ray, which has been advised by the ENT surgeon. But in case of the homeopathy, we are giving the homeopathic treatment along with the steam inhalation. And in case of the involvement of the pharynx, the pharyngitis, that is the sore throat, where we are having the wonderful remedy, homeopathic remedy, that is likewise belladonna and Viathia, Mercayot rubor and Mercayot flavus. According to any kind of the involvement of the organ, we can treat the patient accordingly. So these are the duration of the upper respiratory tract infection, starting with the headache, that is a mild headache. We have to recognize the early detection of the symptoms according to patient. Because of the infection, patient is complaining of the fever itself. The nasal mucosa, whenever patient is exposed to any kind of the infection, the ciliated epithelium of the nasal or mucosa which gets involved and it gets congested. So once the congestion takes place, it presenting with the coryza itself and sneezing, and patient is complaining of the cough and sore throat. So we have to identify if patient is complaining of the cough, whether it is dry one or productive one. And our remedy has been differs from the dry cough and productive cough. If patient is having the dry cough, so we can think of the Spongia tosta, Rumex, then Sticta pulmonale, Drosera and Bryonia itself. If patient is having the productive cough, then we can think of the first is the acute stage of the inflammatory process. Once the infection gets established, then belladonna and ferramphos. And when productive cough, Cilicia, Pyrogen, Heparsulf, Surinum. So any kind of the symptom, we have to inquire properly and take the history and give the remedy in a proper manner. If patient is having the sneezing, the continuous sneezing, we can think of the Sabadilla, we can think of the Erundo, Allium cepa, if patient is having the exposed to any kind of the allergic manifestation. So the upper respiratory tract infection, the duration of the disorders, that is up to 1 week to 10 days. And the symptoms that has been already discussed. The respiratory failure. Any kind of the respiratory failure is having main two components. When patient oxygen saturation decreases and carbon dioxide increases, that reflects the respiratory failure. The main cause of the respiratory failure, that is because of the underlying pulmonary infection. Once the person is exposed to any kind of the pulmonary infection, either in terms of the COPD. So COPD, that is the chronic obstructive pulmonary disease. It is because of the either emphysema, chronic persistent asthma, bronchiectasis, which can leading, and chronic bronchitis, which can leading to COPD, and massive pulmonary infection can leading to respiratory failure. If sometimes patient is having the underlying pathology, underlying pulmonary infection, either pneumonia, the pneumonitis, bronchopneumonia can leading to respiratory failure. So in terms of the theoretical approach, it is having the main two types, that is the type 1 respiratory failure and second is type 2 respiratory failure. Type 1 is divided into acute type 1 and chronic type 1, and type 2 is divided into acute type 2 and chronic type 2. So acute type 1 respiratory failure, it is demarcated by the acute hypoxemia without hypercapnia. So there is no any kind of the CO2 increases in acute type 1 respiratory failure. Only acute hypoxemia takes place. That is the insufficiency of the oxygen saturation towards the capillary or towards the vessels can lead to acute type 1 respiratory failure. A chronic hypoxemia without hypercapnia, that is chronic type 1. Any kind of the acute condition which remains persistent can leading to chronic type 1 respiratory failure. So person is having the chronic lack of oxygen saturation, that is maintained, or alveolar epithelium which gets damaged itself can leading to chronic type 1 respiratory failure. The type 2 respiratory failure, that is acute hypoxemia with hypercapnia. So any kind of the lack of oxygen saturation with increases the CO2 level in acute type 2 respiratory failure. In chronic type 2 respiratory failure, the acute type 2 respiratory failure can lead into chronic type 2 respiratory failure. One of the causes is that. And second is any kind of the respiratory hypercapnia, that is the persistent CO2 level which increase. Either patient is having encephalopathy, the CO2 narcosis takes place, CO2 level increases, either person is exposed to any kind of the occupational hazards. We can think of the acute type 2 chronic type 2 respiratory failure. Sometimes person is working under the gas factory and noxious gas can leading to the type 2 respiratory failure. So underlying pathology according to the symptoms involvement we can inquire. The causes of the respiratory failure, the first cause, that is the any kind of the head injury. During head injury, the intracranial pressure increases. The head injury can be demarcated by the level of the consciousness. We have to inquire the first is the whether patient is conscious, alive or dead in case of head injury. Second is vomiting. That is very important. So the raised intracranial pressure in the head injury, which can leading to the person is presenting with the vomiting itself. Second is the pneumonia. That is very important cause for the respiratory failure. Pneumonia is the nothing but before COVID-19, most of the pneumonia is having the bacterial causes. But after novel coronavirus, it is usually because of the viral entity which is responsible for the pneumonia, where patient is having the lack of oxygen saturation, the oxygen saturation decreases. Relatively, it increases the CO2 saturation and leading to the respiratory failure itself. The third is the asthma. Asthma is nothing but the three main presentation, that is cough, dyspnea and wheezing. So in order to treat the asthma, we have to inquire whether it is bronchial origin or cardiac origin. It is bronchial asthma or cardiac asthma. If patient is having any cardiac pathology, involvement with the valvular heart disease, we can think of the cardiac asthma as well. If patient is having the obesity, if patient is having obese, they require more and more amount of the oxygen from the atmosphere. So once the requirement of oxygen saturation which is more, the oxygen saturation decreases, it relatively increases the carbon dioxide saturation. The fourth is stroke. Any kind of the cerebrovascular stroke can leading to the hemiplegia, can leading to the respiratory failure, because the respiratory muscles and respiratory center gets affected in the and which has been regulated by the nervous regulation itself. So it can leading to stroke, can leading to respiratory failure as well. Pulmonary embolism, next cause. Embolus, that is the plaque formation in the pulmonary vessels. So pulmonary embolism can leading to the pulmonary hypertension, PH. Any pulmonary embolism can leading to the pulmonary hypertension, and which can leading to the right-sided failure. And that right-sided failure can leading to the respiratory failure. The next is the symptoms, that is the confusion, feeling of sleepiness. So any state of the confusion, any state of the confused state of the mind, we can having the jalsemium. We can think of the any kind of the along with the homeopathic treatment, chininum sulf, vertigo, tinnitus, and deafness. So any kind of the roaring in the ear with the roaring feeling, we can think of the our remedy when there is elements from the malaria and confused state of the mind. And jalsemia we can think of when there is marked D along with the dullness, dizziness, drowsiness, then diplopia, dimness of vision, drooping of eyelids, doddering, that is the tremor is the keynote of the jalsemia itself. And once the patient is giving the tremor, we can think of whether it is because of the thyroid complication. We must understand any kind of the symptoms with the underlying pathology. If chronic tobacco users can giving to flapping tremor. If patient is having the chronic alcoholism can giving to flapping tremor, presented with the flapping tremor. Any nervousness can presenting with the flapping tremor. So any kind of the symptoms we have to differentiate it, and condition which is to be suspected is to be underlying with the help of the respiratory failure. These are the next cause that is very important for the respiratory failure. That is the most common cause, that is ARDS, acute respiratory distress syndrome. So chronic, acute, when we say the acute having the majority of the complaints of the acute respiratory distress syndrome is because of the chronic persistent oxygen saturation and acute exacerbation of the symptom. Acutely, patient is having starving the air can leading to acute respiratory failure, and the foremost and basic cause, that is ARDS, that is acute respiratory distress syndrome. Patient is having the life-threatening, patient is having starving the air, they require more and more amount of the oxygen from the atmosphere, and oxygen which is deprived and which can leading to the bilateral pulmonary infiltration and leading to hypoxia, or any kind of the lack of oxygen saturation can leading to the ARDS itself. The most common cause of the ARDS, that is acute respiratory distress syndrome, that is the use of the narcotics drugs, that is the heroin and morphine derivatives, pethidine, inhalation of the noxious gases, person who are working in the under the occupational hazards can leading to the ARDS, acute respiratory distress syndrome. And the systemic disorders, if patient developing the shock, sepsis having the high grade fever, toxemia, uremia having the urine output which is decreases, and toxic look, it is the earliest sign for the uremia itself. Patient looking very sickly indeed, sickly looking expression can be presented with the uremia. Next is eclampsia. If person is having eclampsia, that is the pre-eclampsia having the edema, proteinuria, and hypertension, and eclampsia having the convulsion itself, along with the convulsion and the one of the cause for the ARDS itself. The clinical features of the acute respiratory distress syndrome, that is patient is having the tubular breath sound and may be heard on the auscultation as well. The worsening of the blood gases, the exchange of the gases cannot be properly maintained. That will leading to the blood pressure which is decreases, and the patient is having the any kind of the increased respiratory rate, means patient complaining of the tachypnea. And once the tachypnea, person is having the complaining of the tachypnea, the starving of the air takes place and patient having the oxygen saturation decreases, which can reflect with the cyanotic phase. And cyanosis is nothing but whenever there is bluish discoloration of the skin and mucous membrane, which can describe as a cyanosis, where the increased amount of the reduced hemoglobin in arterial blood. So in mean of the 100, the 95% of the saturated hemoglobin and 5% that is reduced or unsaturated one. So the normal value of the reduced hemoglobin in arterial blood, that is 0.05%. When the amount of the reduced hemoglobin that is more than 5 gram percentage, it is considered to be cyanosis. And having the three types, central cyanosis, peripheral cyanosis, when central and peripheral mix together, which is known as the mixed cyanosis. The central area, inner side of the area which can look for the central cyanosis. Peripheral cyanosis can be looked by the either in terms of the nail bed, conjunctiva. We can think of the peripheral cyanosis, and any kind of the central and peripheral, that is mixed cyanosis. And last, that is cyanosis due to abnormal pigments. We can think of in case of the ARDS as well. The most important pneumonia. The pneumonia is nothing but it's a chronic or inflammation of the lung parenchyma. The simple is that it is defined as the inflammation. Once the linear margin of the lung which gets inflamed, we can call it as a pneumonia, where patient is having the any kind of the pneumonia can leading to the oxygen saturation which can decreases, and it is having the three main variant. The community acquired pneumonia, second is nosocomial pneumonia, and third is aspiration pneumonia. Community acquired means inside the community itself. Pneumonia takes place in the community. That is not known as, and outside the hospital. That is the community acquired pneumonia, which is caused by the mycoplasma, that is responsible fungus or fungal infection for the pneumonia. The second is hospital acquired pneumonia. Patient is admitted, and after 48 hours of the hospitalization, patient is complaining of the pneumonia. The majority death takes place during COVID, that is because of the community hospital acquired pneumonia. The transmitted infection from the hospital itself, which can leading to the pneumonia, that is hospital acquired pneumonia, and which is the most common variety of the common cause of the death of the pneumonia. And patient is leading to the Klebsiella pneumonia, and if patient is alcoholics, it is commonly seen in the elderly patient having alcoholics, that is Klebsiella organism, and majority of the death that takes place, that is because of the Klebsiella pneumonia and hospital acquired pneumonia. That is very common variant. The third is aspiration pneumonia. If any kind of the aspiration or aspiration material which involving the growth of the anaerobic bacteria. Aerobic and anaerobic. Aerobic means in presence of the oxygen, and anaerobic means in the absence of oxygen. So the growth of the bacteria organism itself can leading to the pneumonitis or pneumonia. The symptoms, that is fever with chills. So once if patient is having the fever with rigors, we can think of the, first of all, if patient is having fever, high-grade fever with chills, we can think of either malarial fever, which is very common fever with rigors. The differential diagnosis for the fever with rigors. The chill is because of the breakdown of the RBC in malaria. And in case of the pneumonia, any kind of the drenching and the drain bed can leading to the fever with rigors and high-grade fever. In case of the second clinical condition, if patient is female, we can think of the UTI as well. Urinary tract infection, where patient is presenting with fever with rigor. If patient is pediatric, we can think of the tonsillitis as well. We must examine according to any kind of the local examination, systemic examination, we can know for the underlying pathology. The main symptom of the pneumonia, that is rusty sputum and pleuritic type of chest pain, that is very common in the pneumonia. And once any respiratory disorders, patient is having pleuritic type of the chest pain, we can think of the pleurisy, then pleural effusion, then tuberculosis, having the pleuritic type of chest pain. Any kind of the fracture rib, involvement of the rib, costochondritis, presenting with the pleuritic type of the chest pain. Any pain and cough is the main diagnostic sign of the any respiratory disorder. So we can think of pneumonia once rusty sputum with pleuritic type of chest pain, high-grade fever, drenching in drain wet, and community acquired and hospital acquired, where the infection can get transmitted, and what is the reason, what is the cause of it, and according to homeopathy we have to treat it. And investigation, the X-ray showing the infiltration and consolidation, that is the very common pneumonitis, that is bronchopneumonia, which can be developed. The next disorders, that is the pulmonary tuberculosis. Pulmonary tuberculosis, we must understand any kind of the respiratory disease. To rule out the respiratory disease, we must understand whether it is caused by the bacteria, whether it is caused by parasite or viral or fungi. So Pulmonary tuberculosis, it's a type of the acid-fast bacilli. And techniques for the staining, that is ZN staining. The Zeal and Nelson designated the staining techniques to for the just a minute. Zeal and Nelson so ZN staining, it is caused by the acid-fast bacilli, Mycobacterium tuberculosis or tuberculi bacilli responsible for the tuberculosis. The main symptoms, that is chest pain, evening rise of temperature, and hemoptysis, spitting of blood along with sputum. Once the person is having the hemoptysis, we can think of the CA lung, bronchogenic carcinoma is the important diagnostic features for the hemoptysis, is the important diagnostic tool. So we have to identify hemoptysis with clubbing of finger in case of bronchogenic carcinoma. While in case of tuberculosis, we can think of presence of tubercle bacilli, and it can be confirmed by the sputum examination and X-ray examination, X-ray chest. So, and according to the symptom, weight loss, evening rise of temperature, pruritic type of the chest pain, cough more than 3 weeks of duration, and night sweat and hemoptysis. The physical signs of the tuberculosis, patient is having the low immunity, the immune compromise or weakness and debility, patient is exposed to any kind of the allergens and infection, and immunity is low once person is having the tuberculosis. So similar kind of the HIV infection, patient is having the low immunity, any kind of the immunological factor in disease, immunological changes which can leading to the low immunity. So we can think of the physical sign in terms of the in pneumonia, that is crepitation, and mostly crepitation can be heard on the lower lobe of the lung. The general symptoms, which has been already discussed, that is weight loss, anorexia, that is loss of appetite, and a similar kind of the, if patient is having, person is having anorexia, we can think of the any underlying liver disorder itself. Because respiratory disease, think of any tuberculosis. If patient is complaining of anorexia, anorexia is the important tool for the any kind of the liver disease itself. The second is evening rise of temperature, night sweat, that is the mental symptoms, that is the disturbance of the any kind of the respiratory involvement. The constant cough, early morning cough, that is the diagnostic tool for the pneumonia, for the tuberculosis, and direct observation treatment for short course therapy, that is the government guideline for the to treat the tuberculosis under the RNTCP, revised National Tuberculosis Control Program, and it will be available for the all the urban health center and PHC and CHC, where the dots under with the category wise, category 1, category 2, and category 3, under the immune compromised patient, we can think of the various kind of the treatment for the AKT, that is anti-cox treatment with dots. AFB, which is positive, that is acid-fast bacilli, which shows in the positive history. X-ray chest, that is the new consolidation and cavitation of the tuberculosis. The next disorders, that is the chronic obstructive pulmonary disease. COPD having 4 main types: chronic asthma, chronic persistent asthma, bronchiectasis, chronic bronchitis, and emphysema. What do you mean by COPD? Whenever there is distension of the airspace, any kind of the distension can leading to the destruction of the alveolar septa, where the destruction takes place in emphysema, which is not there in case of the bronchiectasis. Distension of the airspace, which is there in case of bronchiectasis as well as emphysema, but destruction which is presenting in case of emphysema and not there, which is not there in case of the bronchiectasis. So the main presenting with the bronchial asthma, when patient is most of the bronchial asthma, usually it is because of the allergic response. The bronchial asthma is nothing but it is characterized by paroxysm of the dyspnea, means patient is complaining of breathlessness, and which is accompanied with wheezing, associated with the wheezing, and this results from narrowing of bronchial airway. Bronchial constriction takes place by muscle spasm, mucosal swelling, and viscid secretion. And why asthma occurs in the lying down posture? That is because of three reasons. Because of the during lying down posture, there is elevation of the diaphragm takes place. Second thing, the more blood to the heart and suppression of the respiratory center can leading to the dyspnea, which is usually takes place in the lying down posture. And the three main presentation of the asthma, that is having the main two classification, early onset and late onset. Early onset, that is atopic, that is allergic manifestation, which is very common in children and 5 to 15 years of age group. That is early onset asthma. It is also known as extrinsic asthma, where responsible allergen is there. The second type, that is late onset asthma, that is non-atopic asthma, intrinsic asthma, or idiosyncratic asthma. Idiosyncrasy means in terms of organon, it is a state of hypersensitivity and hypersusceptibility. So bear in mind, idiosyncratic patient is born with the state of hypersensitivity and hypersusceptibility, and allergic is a person is sensitized to that particular thing, either pollens, either dust, either fumes, either itch mite, either weather can leading to the asthmatic episode. So the main three presentation of the asthma, that is the dyspnea, cough, and wheezing itself. And sometimes dyspnea, that is because of the bronchial constriction. Wheezing, that is because of the triggering of the cough, and which can produce a sound which is known as the wheezing sound. And whenever there is a rattling, excessive rattling, and affection of the pneumogastric nerve, we can think of the ipecac and enteric likewise. And asthma having the risk factor, that is air pollution. Sometimes patient is exposed to fumes. So cigarettes, passive smoking, that is more hazardous as compared to active one. Sometimes what happens, the noxious gases can leading to the person having the low immunity and exposed to allergens can leading to the asthmatic problem, asthmatic spells in a given case. These are the features of it, where the SpO2 and severe life-threatening attacks, that is the late onset asthma, which is very commonly seen in the adult age group after 45 to 55 years of age group, where patient is having the negative skin hypersensitivity, which is positive in the atopic asthma, early onset asthma. Episodic asthma, asthma in episodes. When the patient is having sudden onset of asthma and we have to tackle the emergency, which is known as the status asthmaticus, where patient is depriving of the oxygen saturation and it must be considered as an emergency one. Once the acute exacerbation of the symptoms, that is status asthmaticus, once the acute phase is over, then we can switch on to the chronic remedy. The chronic asthma, chronic persistent asthma, where person is having the chronically the involvement of the chest tightness, that is the dyspnea, wheeze and cough, and which is very common if patient is having the long-standing exposure to any kind of the pollution can leading to the chronic persistent asthma. And sometimes the underlying pathology, underlying respiratory diseases can leading to the chronic asthma. The next is chronic bronchitis. Chronic bronchitis, where patient is having cough more than 3 months in a year and consecutive for 2 years, then and then only it is stated to be chronic bronchitis. Where patient is having cough is the presenting symptoms, and along with the cough, mucopurulent sputum, any kind of the respiratory disorders, the main cause, that is chronic smoking. Most of the respiratory disorders, the cause is chronic smoking, can leading to all the respiratory disorders, and takes presenting with the pleuritic type of the chest pain. These are the COPD affects the body, that is chronic bronchitis, where patient is having the blue blotter. Blue means presence of cyanosis, blotter means presence of peripheral edema itself. So patient is having the cough, which is very common in the obese individual in case of the chronic bronchitis. Next is emphysema, where in case of chronic bronchitis, on X-ray chest, the bronchovascular marking which is prominent. While in case of emphysema, which we have already discussed, emphysema is nothing but it's a distension of the airspace with destruction of the alveolar septa. And the emphysema, the presentation of the chronic bronchitis, that is cough. While in case of emphysema, the presenting with the dyspnea, that is breathlessness. Chronic bronchitis, which is very common in obese individual, while in case of emphysema, it is commonly seen in linked in debilitated constitution. In case of chronic bronchitis, bronchovascular marking which is prominent on X-ray chest. In emphysematous bullae, on radiographic appearance of the emphysema. Bullae means bubble-like appearance on terminal bronchioles, and we can think of the presenting symptoms. These are the healthy lung and emphysematous lung, bronchitis, phlegm, breathlessness, cough, and fatigue itself, and weight loss. Bronchiectasis is the permanent dilatation of the lungs or parenchyma of the lung, and where tram track appearance can be observed in case of the bronchiectasis. The signs and symptoms, that is chronic cough along with the hemoptysis. So hemoptysis is also present in tuberculosis, in bronchogenic carcinoma, and bronchiectasis. These are the, and any hemorrhagic disorder can leading to the hemoptysis as well. Bronchial carcinoma, today is the lung carcinoma day. Any CA lung where it is because of the chronic smoking. Chronic smoking, if we smoke, the inhaled air can leading, it combined with the carbon monoxide. CO is combined with the hemoglobin, and the once they combine with the carbon monoxide, and which is noxious to the pulmonary epithelium, and it will leading to the bronchial carcinoma. The bronchial carcinoma is having the three main variety. The signs of the collapse, consolidation, cavitation, mediastinal obstruction, and presenting with hemoptysis and clubbing of finger. That is the hallmark of bronchial carcinoma. Next is pneumothorax. Whenever there is collection of the air in the pleural cavity, because of any kind of the trauma to the chest wall. Injury is the main cause of the pneumothorax. It is having the three types: closed pneumothorax, open pneumothorax, and tension pneumothorax. Closed pneumothorax, that is the reduced chest movement, hyperresonance breath sound, mediastinal shift to the opposite side, and coin test which is positive. And pneumothorax having the iatrogenic, that is open, second type, that is open one, where we have to remember from cave, crackpot sound on percussion, amphoric breath sound, and voice and cough may be heard like metallic echo. And tension pneumothorax, that is DI, displacement and increased respiration, tachycardia, and palpitation. So these are the types of the pneumothorax along with the iatrogenic causes, and pneumothorax can be remembered with the, these are the mnemonic of it. So any kind of the steering wheel impact against the driver chest, the road accident can leading to the pneumothorax. Any kind of the infection, secondary infection to the lung parenchyma, that is because of either empyema thoracis, either pneumonia, can leading to the pneumothorax. The next is the pleural effusion. Pleural effusion, whenever there is, lungs is having two layers, parietal pleura and visceral pleura. Whenever there is abnormal accumulation of the serous fluid in pleural sac, which is known as pleural effusion, when patient is having the complaining of the pleural effusion, the sternocleidomastoid, which is prominent, glucose triangle, positive glucose triangle, obliteration of the strep space, Skodek resonance, these are the signs of pleural effusion. And the movement of the chest wall, that is diminished. The affected side of the pleural effusion, that is immobile, right? And that is the background thoracocentesis. Either sometimes pleural effusion is because of tuberculosis. Secondary to tuberculosis can leading to the pleural effusion. That is the very common pleural effusion because of the tuberculosis. So we have to aspirate the pleural fluid, and go for the examination. Very important, COVID-19 novel coronavirus. Patient is having complaining of dyspnea with signs of the pneumonitis, and patient is complaining of fatigue, weakness, fever, that is high grade 1, and sore throat, starting with the majority of the patient. And these are the differentiating point for the, in 2016, the H1N1 infection, that is swine flu as well. In 2020 and 21, the second wave of 21 of novel coronavirus. So we have to understand flu, that is influenza virus, anti-cold, and coronavirus in terms of the different kind of the symptoms: fever, fatigue, sneezing, sore throat, diarrhea itself. The most important, that is homeopathic view of the approach in terms of the respiratory disorders. Before that, we must understand any kind of the effect of the organon, effect of repertory, and materia medica. Unless and until we are not knowing the exact indisposition, that is the transient alteration in the state of health. Temporary alteration can leading to acute exacerbation, acute, that is severe acute asthma, status asthmaticus, respiratory failure, acute exacerbation, acute episodic. So any kind of the indisposition, mechanical ventilation, according to the classification of Hahnemann, it is already discussed in the master in their aphorism in organon. The first remedy, that is aconite, it is given when sudden and violent in onset and aggravation in warm room, better in open air. It is the acute remedy, acuteness of the, and patient is having the restlessness, that is the mark of the aconite. Patient is very strong in behavior, so keeps on moving from place to place for the searching of the soft place, and tossing in agony for aconite patient. And master, the next remedy, that is allium cepa, acrid nasal discharges, blend lacrimation, and ailments from warm room, that is the wonderful remedy for neuralgia, phlebitis, sue bite, and respiratory infection, that is because of person is having the draft of cold wind can leading to the respiratory complaint in case of allium cepa. So we can think of euphrasia as well. Euphrasia is having the acrid lacrimation and blend coryza, that is the reverse of allium. And euphrasia, the important features of euphrasia, ailments from head injury and concussion and contusion of brain, just like natrum sulph and arnica. Arnica, natrum sulph, euphrasia. Ammon carb is having wonderful remedy for the respiratory complaint when the patient is having the snuffles of infant, and epistaxis when washing the face, especially in the morning. Once we think of epistaxis, there is nosebleed, we can think of phosphorus, bryonia, vicarious menstruation, when epistaxis, when nosebleed, when menses should appear. And along with the next remedy, that is entim tart. Entim tart prepared from tartar emetic, affection of the hydrogenate constitution of the gravel, and disease originating from the damp basement and damp cellars. We can think of the entim tart, tartar emetic, where it relieves the death rattle. And when the patient coughs, there seems a large collection of mucus in trachea and bronchi. As much would be expectorated, but nothing comes up. So whenever there is patient thinks that no any kind of the phlegm is remain inside the chest, we can think of phosphorus, causticum. But we must understand phosphorus, causticum, apis, rustox is inimical to each other. So we can understand the relationship of the remedy in order to prescribe the remedy as well. Arsenic during CCRH guideline as per the Central Council of Research in Homeopathy, the arsenic 200, which was prescribed for the combat the novel coronavirus. So in terms of the novel corona, arsenic, whenever there is patient is having trio of burning, arsenic, phosphorus, and sulfur. Arsenic is chili patient, phosphorus chili, and sulfur is hot. And arsenic is trio of burning pain. Arsenic, phosphorus, and rustox. Along with the arsenic, phosphorus, and sulfur, aconite, arsenic, and rustox. These are the trio of restlessness. And arsenic patient is mentally restless but physically too weak to move. And patient is having thirst for small quantity of cold water at a shorter interval in case of arsenical, and better by heat, which is also present in Lycopodium, Chelidonium, Podophyllum, better by warmth. It is the main key features for the arsenic. Belladonna, acuteness or any kind of the acute disease, sudden and violent in onset. And always remember Bella for beautiful and lady. Donna means lady. Sandy hair, silky hair, blue eyes, fair complexion. And being acuteness, lascivious mania in case of the Alzheimer, violent mania in case of belladonna, and religious mania in case of the stramonium. So religious mania in case of stramonium. So belladonna is having the birds, that is burning, inflammation, redness, delirium, and spasm. And the acute exacerbation is over, then we can think of calcarea carb as well, the chronic of belladonna. The sabadilla, that is already discussed, allergic manifestation, which can be think of any kind of the hay fever, any kind of itching on the upper palate, we can think of sabadilla. The Sambucus nigra. The Sambucus is the remedy for the snuffles of infant, where patient is having the aggravation from lying down and aggravation by cold air. Cold air aggravation we can think of Sambucus nigra as well. And this is the case of one case was there. These are the symptoms in colloquial language, that is in Gujarati. If I could move, my heart will stop to beat. And on the basis of the observation from the case, and we have selected the remedy. And these are the totality of the ipecac, which was given on the basis of the dry, spasmodic, constricted, and asthmatic cough. Ipecac is a wonderful respiratory tonic in terms of to treat the asthma, where patient is having the gastric involvement, vomiting, constant and continually nausea with persistent clean tongue, which was there in a given case. And ipecac was prescribing, and patient were giving complaining. The similar kind of the symptom which was covered with the help of the Kali bichromicum and Kali beach, which was given for the to cover the phlegm and to cover the chronic bronchitis. And patient is complaining of cough and circumscribed pain patient is having, and which can be covered with the tip of the finger. And the patient is having complaining of the tenacious ropey discharges. So we have differentiated the crocus, hydrastis, then Kali bichromicum, and on the basis of the causative factor of the Kali beach, I have prescribed the Kali beach. And this is the respiratory disorders. And the take-home message for the any kind of the homeopath, that is any kind of the symptom, we have to understand the individualization. The role of the homeopathy is to give the proper inquire about the case taking only. And unless until we are not knowing the organon, materia medica, and knowledge of repertory, and use the application of the materia medica in your clinical therapeutics, that is application of materia medica in day-to-day practice, that is your medicine therapeutic. So in order to treat the patient, we have to understand and each and every disorders in terms of the symptoms matter. So thank you very much, Dhanesh sir, for providing me such a wonderful platform, and I have give the insight in terms of the respiratory disorders with the homeopathic concept.
Thank you so much, sir. I think Dr. Vibhu Prasad sir want to ask you something, sir.
Am I audible?
Yes, sir.
Sir, really it is a fantastic presentation with extensive one, and covered almost all the diseases, their therapeutic aspect, everything else. Sir, you are having more than 25 years of practice, so please share that we know that constitution is the soil in which disease grows. So for the prevention purpose or prophylactic purpose, so if you are having the history, then can we prescribe some medicines by which the offspring they will be prevented from different type of respiratory infections?
The role of the constitution for the chronic disease, which is very important, because unless until we are not knowing the role of the constitution in terms of the organon as well as the importance of the constitution for materia medica point of view. If patient, we are knowing the physical makeup, we can able to prescribe the remedy. If patient is having linked in debilitated constitution, we can think of tubercular diathesis in a given case. And according to the tubercular diathesis, we can know the effect of the respiratory disorders or chest disorders, which is very common in that. And we can know the phosphorus, calcarea phos, tuberculinum. These are the remedy for the constitutional adaptability. If patient is having the fair and fat flabby personality, we can think of calcarea carb. If patient is having the narrow chested personality, we can think of the sabadilla as well. So any kind of the constitutional adaptability which brings on disease and certain preventive remedy, that is the, if patient is having the belladonna, we can give in terms of the scarlet fever, which means any kind of the preventive remedy which is having the role of the acute exacerbation of the symptoms. Once the acute exacerbation of the symptoms is over, then switch on to the constitutional adaptability or constitutional treatment in a given case.
Being an academician, what will be your message for our students and our colleagues for the prevention and protection of respiratory diseases, because the lifestyle of today's scenario is very dangerous?
Yes, sir. Yes, sir.
So Dr. Danesh sir want to say something, sir, because only 3 minutes more, please.
Yes, sir, it's really an excellent session, a powerful session,
Thank you.
and we really loves it because this kind of presentations are really very good for not only for the doctors but also for students as well as those who watch from outside. And we all know that homeopathy has done wonderful part in managing respiratory tract diseases, whatever may be. And actually, we need to present some cases in the next session so that people
Sir,
will get
sir,
an idea.
I have prepared homeopathically and
Yes.
allied portion. I
Yes.
will give a second
Yes.
session as well.
Yes, everything was covered, but with lack of time, only just 1 hour we can do only this much. We can have a second part and in which we can have some 4
Yes.
to 5 cases to be presented so that people will know how homeopathy doctors treat these managing this kind of diseases. Anyway, you are the person behind the successful running of IFPH show nowadays because you have given more than 60 persons for the time being. And of course, we would like to have a session with you in live in your college or somewhere else if possible. In Gujarat, we are willing to come over there and we will ready to be there to celebrate one of our celebration so
Yes.
that all we can come in and join one another for the benefit of homeopathy. And that's what we are doing here also. Thank you very much, sir, for your excellent session.
Thank you, sir. It is really a privilege for us to get a lecture from you, sir, really. Because even though it is a vast subject, you covered all under the same time, but not get enough time to get the case presentations. Okay. Anyway, we will expecting the second session of this one, sir. So thank you so much. I think our time is only 1 minute. So I think Ram Parvesh want to say something. You can say something in 1 minute, please.
Thank you, Dr. Sheila, and Namaskar, Dr. Panda sir, Ganesh ji, and everyone, and congratulations, Dr. HITARTH Mehta sir. Very nice, excellent session. Respiratory disorder. Really
Thank you, sir.
dynamic session. And respiratory is the very important the part of body. Inspiration, expiration, and carriage of oxygen. And many kinds of describe the homeopathic medicine, lot of medicine, but but constitutional remedy is the very good. Constitutional remedy, belladonna. बेलाडोना का कंस्टिट्यूशन वर्ड BIRD वर्ड बर्निंग, इन्फ्लामेशन, रेड, and delirium is called Velar. So very, very thanks behalf of
Thank you, sir.
IFPH whole team.
Thank you.
Very, very thanks. Thank you, sir.
Thank you, Dana sir. Thank you. Thank you, madam.
Thank you, sir.
What
Tomorrow
can
we
you
will,
do?
yes, tomorrow we will have a session from Dr. Urmila Bulgaria. She is the Associate Professor and PG Guide, Department of Practice of Medicine, Ella Shah Homeopathic Medical College, and is a physician and researcher at New Life Homeopathy Clinic. And the topic of discussion will be Beyond Hormones, the Art and Science of Whole Human Healing.
Thank you,
Okay,
sir.
sir. Thank you so much. So now time is over. So passing to the Malayalam session. Thank you everyone who participated in this wonderful session. Once again, thank you.